Well, let's get people up to speed on sort of what the instructions for home care entail. People go home, as you know, on medications of various kinds. The three general categories are a narcotic pain medication, some medication to deal with muscle spasm, and we could talk a little bit about that and how big a component of your discomfort was due to muscle spasm versus the direct trauma and pain from the bar. And then thirdly, some anti-inflammatory medication in order to sort of reduce the inflammation of the healing process and in turn make it less necessary to take narcotics for pain. So those are the three categories of pain medication, and along with that was a desire to keep you active, but not too active, right? And that's also a very fine line.
Yes, it
in terms of, you know, what you should and shouldn't be doing. It's a moving target, pain management, right? Because this is a very dynamic process. You're going home at one fixed moment in time when your body is at one stage of its healing and recovery, and then over time that biology changes. The pain and amount of pain and quality of pain changes, and you need to be able to modify that pain management outline to tailor-make your pain medication strategy to that particular moment in time. And I think a lot of patients find that very challenging because it's, again, requires body awareness and the sense that I need to alter over time the amounts of pain medication and when I'm taking them.
I think beyond the medication, I think it's also very important that when you do go through something like this, a recovery like that, it's good to have somebody with you. To do it alone can be very trying.
I think that's an excellent point. And as we talked about, I think not only do you need some help with this, but you also need to be very, very meticulous in your noting when you're taking medicines, how much you're taking. A drug log or a written history of what medicine you're taking, how much you're taking, and the time that you're taking it. Just as a nurse would do in a hospital setting, is important for families to adhere to at home, because you, especially when you're taking powerful pain medications, often your sense of time can be altered and your memory can be altered. And if things aren't written down, you can lose track of what was taken and when. And so it's very, very important for families to help patients by keeping an accurate log and making certain that time intervals and dosing amounts and individual medications are all kept straight.
How's it going?
No, you're out there doing things that you were unable to do.
Wow. Thank you so much.
You're welcome.
Happy to be debt free.